Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday, but today Wednesday, on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 27th of July. We invite you to submit your questions via Facebook at NU Institute Global Health or by email at globalhealthinstitute@northwestern.edu. And leading the discussion today is myself, Havey, a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Great. Thank you, Sophie.
In the United States, yesterday, we saw 163,000 positive new cases, and this trend is just increasing. In the United States, our 7-day average is 126,000 positive cases. And Dr. Murphy, I remember a couple weeks ago, I was just saying that we were in like the 90,000s, and here we are today. Hospitalizations have increased by 12%. Deaths have also increased by 10%. And about 520 people died yesterday of COVID in the United States.
That's up.
It's a high number. In Illinois, yesterday, we saw only 5,000 positive new cases, but on July 25th, Illinois had nearly 14,000 positive new cases, with cases increasing by 6%, hospitalizations increasing by 9%, and fortunately, deaths in Illinois are decreasing by 9%. Okay, what can you tell us about these numbers are just getting higher and higher and higher and higher?
Well, everybody has to keep in mind, and we've mentioned this multiple times, but these numbers are off by a factor of probably 7. So it's not 150,000, it's 1 million cases. This is all due to BA.5. So BA.5 is the current variant. I think it's 82% of the variants now in the United States. It is so contagious. Prior vaccination, prior COVID doesn't seem to help. But the immunity, the cellular immunity that the vaccine delivers and prior infection delivers do prevent BA.5 from causing severe disease. So we're learning more and more about this disease as we go along. So there's like the upper respiratory infection, nasal stuffiness, sore throat, hoarseness. And then if it goes beyond that, it gets down into the lungs and into the body. And like, this is bad. So, but it's protecting from the latter part. The infections are relatively mild. Even so, there are still people breaking through that, because if you look at these numbers, we are as a country not up to date with these vaccines and boosters. The kids have been approved now for under 5 years of age. Very, very low uptake, 1.8%, something like that. And I think only from 5 to 11, something like 18%. So, we're letting that pool add to the problem. In other words, the pool of the young kids, they're just going to they'll spread it to the adults and the people that are at high risk. So anyway, and then our booster status with the population remains very low, only 30.6%. So, we know that if you have 1 shot, you get some protection. 2 shots gives you more protection. 3 shots gives you even more protection. And then the difference between 3 and 4 gets less, but it's still better. So, the government has, and the public health authorities have basically just given up on trying to push these things out there, I would say. Companies can mandate it. Everybody is in it for themselves. Everyone has to just take care of themselves and do what they think is best, because it's not going to come from any kind of central authority.
Yeah.
I was on a plane last night. I think maybe 5 people were wearing a mask, none of the crew. I was in Africa recently. A lot of people were wearing masks. They're taking it much more seriously there. Europe is kind of in between, but people, they're tired of it. But what's happening is the hospitalizations are creeping up and the death rate is creeping up. But compared to the number of cases, it's still very low.
Right.
But if we can live, we have to just accept. Now
right.
100 people per day are dying from this.
Yeah, no,
2
exactly.
airplane crashes a day of COVID patients, basically. So it's just the way it's going to go. The United States has some of the worst statistics of high-income countries, our peer countries. You know, that's the state of what's happening right now. So
Yeah. And, this goes right into our first headline, which is that the CDC is signing off on Novavax COVID-19 vaccine for adults. So what can you tell us about if this will help the uptake of vaccinations in the United States?
yeah, I think anything will help. I think the Novavax vaccine is good. It's an older technology with an adjuvant formulation that's very novel, but it's the older technology. It is not an mRNA vaccine. And so there are some people that are obsessed with mRNA vaccines, despite billions of doses being administered. They're afraid of those mRNA vaccines. Go with the Novavax one. If that's what bothers you, you now have a choice, and you can take it, and it works. It works just fine.
Yeah, that's wonderful. And now going into our second big headline, scientists are narrowing in on why some people keep avoiding COVID, like myself, and BA.5 could end this luck. Okay, what can you tell us about, 70% of the country having had COVID and this 30% having lucked out?
Well, in every epidemic and pandemic, there's always some people that don't get it. And for some reason, probably genetic, they don't get it. And so it's going to be interesting to study them. But with BA.5, those people are dropping by the wayside. They're all getting infected. They're starting to get infected. So, but we are looking at those people that still haven't, the smaller and smaller shrinking group that haven't gotten it infected yet. But and we'll see how long they can hold out. And we'll see.
Yeah. And now for our last headline.
Yeah.
Our last headline that doesn't exactly relate to COVID, but has a big connection, is that the Biden administration is now considering monkeypox to be a public health emergency, as there is a massive outbreak going on in the United States. So what can you tell us about what's going on with monkeypox right now?
Well, it's another botched response to an outbreak that is, again, underreported because it's so hard to get the test. Even with the commercial test, it takes forever. Not forever, but it can take 7 to 10 days to get the results back. That's not really helping as too much. It helps a little, but they should have declared the emergency weeks ago. Same thing with the WHO. Even the head of the WHO, when his committee that advised him, the first time they met, they said, no, it's not an emergency. We can deal with this. And of course, that's not true. Second time they met, a majority voted to not declare an emergency, and he overruled them. And good for him. Let's not make the same mistake twice in a couple of weeks, which is what was going to happen if he had followed the advice of his committee. Here in the United States, we're still dilly-dallying. Okay, we now have a pregnant woman who got it. Everything went okay with her and the baby. We have 2 kids that have gotten it. Everything went okay with them. In Africa, now they're reporting the cases because they can make the diagnosis too. PCR is available pretty much everywhere somehow. But anyway, of 4 pregnant women in the Democratic Republic of the Congo, 2 of them had miscarriages and 1 had a fetal death. So, that's what we're afraid of. And, pregnant women are at risk for a lot of these infections. So it's already jumping. In other words, it's already jumping out of the MSM community. And, if this thing isn't tamped down quickly, it's going to spread to other groups. Because so many MSM have it, and the way they're getting it through this close contact, it's actually now becoming a sexually transmitted disease. It's technically, everyone keeps saying it's not a sexually transmitted disease. However, now it's a sexually transmitted. It's become a sexually transmitted disease. People are showing up at these sexually transmitted disease clinics, and they're having weird lesions. Now they have to think of monkeypox. It's not just syphilis and gonorrhea and all the other stuff they normally get. It is, sexually transmitted. but you have to throw monkeypox into the equation too.
Yeah.
So that's the status. It's fortunately not very fatal. A few deaths. There's 2 cases of encephalitis in the United States now. So that's quite severe. But as far as I know, no deaths in the US. There's been deaths worldwide though.
Right. Right. Well, and now for our first and only question, and one that I feel like Dr. Murphy we address every week, but I think it gets more important as the cases are increasing. So when can I/should I get my booster shot after getting COVID? If I've had COVID a couple months ago, like when should individuals be getting their booster shots?
Yeah, definitely the most common question we get. And the answer is pretty much the same. I think we have to reinforce it though now for a couple reasons. One is if you are due for a booster shot, get it now. It's going to help prevent you from, you're going to get BA.5 Omicron. So you want to be as protected as possible against severe consequences of that. It won't prevent you from getting it, but it's going to prevent you from getting really sick. I mean, look at Tony Fauci. Look at Joe Biden, 79 years old. Fauci's 82 years old.
Yeah.
That and Paxlovid will get you through it. And so that's great. That's good news. However, only 30% of the country's even boosted with 1 dose. And a lot of people should be getting their second one.
Yeah.
Get up to date with that now, because we don't really know the exact date that the version 2 vaccines, which are molecularly designed more for Omicron variants, when they're going to be approved and out there. Originally it was September, then October, then November, then sometime this year. Just get boosted now. When the next one comes out, take that too.
Well,
don't wait.
no, it's very simple. And that's the unfortunate part.
Very simple. Get up to date with your booster. I've been getting a lot of calls and comments about weddings that are coming up or big social events with mixtures of people. The best thing you can do is, because now no one's going to tell you what to do. Maybe mandates are going to come back in. Some of the universities in California have put the mask mandate back.
Yeah, I saw that.
Could be coming, But, in general, there's no more mandates. But what can you do? You can ask all your guests to be vaccinated. You want to really be tough, vaccinated and up to date with their boosters, right? You can, do things outside. You can have all the wait staff wear masks.
Yeah.
And you can do testing. Say you have a wedding with 100 people or something, send them all a box of tests and have them test the morning of the event, or whatever the situation is. If it's a Friday, Saturday, Sunday thing, they can test themselves every day. The tests are available now. They've been given out free by the government. You can buy them in the pharmacy. But the combination of being up to date with all your vaccines, having some mask requirement, maybe with the staff at the place, or certain people who are attending, they should be allowed to wear a mask or encouraged to wear a mask, and having the testing available. I mean, if you put all that stuff together, you're going to have a much safer crowd. I mean, this thing is so contagious. People are having like small outdoor parties and everything, and 3 people are getting infected or something like that. It's just incredible how many people are getting infected. So, but there are things you can do. And if you're in one of those risk groups and you qualify, you should take Paxlovid. And that will help even further, whether you're vaccinated or not. Doesn't make any difference. And now the drug is available. It's free. The government has already purchased it. And it compared to what we were talking about a month or 2 ago, it's very easy to get at this particular point.
Yeah, absolutely.
So that's what we got to do.
Well, Dr. Murphy, those were all of our COVID questions for today, and we will see you all next week. Thanks, Dr. Murphy.
See you next week, and we'll see you on WGN this Friday, 7 a.m.
Thanks.